Welcome to Policy and Rights, the show about human rights and government policy. Okay, welcome back everyone. You're listening to Policy and Rights here on Depictions Media Radio. And you've probably seen a number of things happening and going on, especially in the fact that you've probably seen that the COVID vaccine is being released and governments across Canada are actually rolling it out. And there's some goings on with that. The premiers are asking for more doses and are asking for a federal step up of the vaccine rollout as it's coming. And there are some things on the global end of things where you're going to hear a statement from the Director General from the WHO, Dr. Tedros, making a statement about that there are only 42 countries in the world that are currently distributing the vaccine, and out of those 42, 36 are the world's most prominent countries, and the final 6 of the 42 are more of a middle-income kind of country that are actually have the vaccine on hand and are starting to distribute it. The issue, as he discussed it, is that the vaccine is not really available to lower income countries, those countries that might have some struggles financially to purchase the vaccine. And he's urging the use of COVAX to get that vaccine to those other countries. There is a strong scientific evidence that if we don't eliminate the virus everywhere, that our efforts to do it anywhere could actually fail. So he's urging the countries that have the income to help supply the vaccine to those countries who do not have the income to purchase the vaccine. So why don't we listen to Dr. Tedros and the WHO statements first and move on from there. Thank you.
Hello all. I think our technical problems are being solved now. I am Fadela Shaib, speaking to you from WHO headquarters in Geneva, and I welcome you to our global COVID-19 press conference today, Friday, 8th January. Present in the room are WHO Director General, Dr. Tedros, Dr. Mike Ryan, Executive Director, Health Emergencies, Dr. Maria von Kerkhoff, Technical Lead for COVID-19, Dr. Bruce Aylward, Special Advisor to DG and Lead on ACT Accelerator, Dr. Mariangela Shimau, Assistant Director General, Access to Medicines and Health Products. Joining us remotely are Dr. Kate O'Brien, Director, Immunization, Vaccine and Biologicals, and Dr. Ed Kelly, Director, Integrated Health Services. Welcome all. We have simultaneous interpretation in the 6 UN languages plus Portuguese and Hindi. Now, without further delay, I would like to invite Dr. Tedros for his opening remarks. DG, you have the floor.
Thank you. Thank you, Fadila. Shukran. Good morning, good afternoon, and good evening. COVAX, set up by GAVI, CEPI and WHO in April last year, has now secured contracts of 2 billion doses of safe and effective COVID-19 vaccines, which we're ready to roll out as soon as the vaccines are delivered. And we also have the right of first refusal on an additional 1 billion doses. However, this is where the current challenge is. At present, 42 countries are rolling out safe and effective COVID-19 vaccines. 36 of these are high-income countries, and 6 are middle-income countries. So there is a clear problem that low and most middle-income countries are not receiving the vaccine yet. This is a problem we can and we must solve together through COVAX and the ACT Accelerator. At the outset, rich countries have bought up the majority of the supply of multiple vaccines. Now, we're also seeing both high and middle-income countries that are part of COVAX making additional bilateral deals. This potentially bumps up the price for everyone and means high-risk people in the poorest and most marginalized countries don't get the vaccine. And some companies and countries have not submitted critical data, which we need to issue emergency use listings, which blocks the whole system of procurement and delivery. Vaccine nationalism hurts us all and is self-defeating. But on the flip side, vaccinating equitably saves lives, stabilizes health systems, and would lead to a truly global economic recovery that stimulates job creation. Importantly, it would also help us limit the virus opportunity to mutate. The current variants show that the virus is doing its best to make itself more suitable to ongoing circulation within the human population. This is normal of every virus, but at present we're helping it thrive if we don't reduce transmission and vaccinate equitably. Going forward, I want to see manufacturers prioritize supply and roll out through COVAX. I urge countries that have contracted more vaccines than they will need and are controlling the global supply to also donate and release them to COVAX immediately, which is ready today to roll out them out quickly. And I urge countries and manufacturers to stop making bilateral deals at the expense of COVAX. No country is exceptional and should cut the queue and vaccinate all their population while some remain with no supply of the vaccine. Science has delivered. Let's not waste the opportunity to protect lives of those most at risk and ensure all economies have a fair shot at recovery. It is a massive undertaking to ensure health system planning, coordination, training, and logistics are set and able to roll out vaccines in the midst of a COVID-19 surge. The 100 initiative driven by WHO, UNICEF, and the World Bank is supporting over 100 countries to conduct rapid readiness assessments and develop country-specific plans for vaccines deployment. And we have hit our target. 100 countries have now completed this critical process, and the governments and health systems are on standby for global vaccine rollout. We're ready. COVAX is ready. Countries are ready. The time to deliver vaccines equitably is now. This is a very dangerous time in the course of the pandemic, and I do not want to see people become complacent as vaccines are starting to roll out. Over the past few days, we have seen some of the highest numbers of deaths recorded at any point in the pandemic. This is happening because over previous weeks, there has been a lack of compliance with what health authorities are advising in several countries. The virus has taken advantage of this and is spreading at an alarming rates in some countries. You might think that it wouldn't happen to you, and that you don't need to comply with the measures. The problem is that before you know it, not complying a bit becomes a habit. People you know mimic the behavior, and the whole system breaks down. Not complying with recommended measures gives the virus opportunities to spread, putting you and your loved ones at risk for infection, and for more people to develop severe disease, and for more pressure to be put on health workers. People need to know that they can personally stop the virus, and they need to know that the virus can stop with them. If I said one thing to people in areas where there are high numbers of cases, it would be to do all you can to avoid mixing with people from other households, especially inside. Because the virus thrives when people gather in groups, especially inside, where people are less inclined to physically distance, wear masks and hand wash, and where windows aren't open and there is not adequate ventilation, which means everyone is sharing the same air. In this difficult period, it's best to meet virtually, but if you have to meet others, do it carefully and with the right precautions. Meet outside wherever possible. None of us are exceptional, and the more we can break the chains of transmission and stop the virus ourselves, the more we will avoid severe cases and tragic deaths. This year is the year of the health and care worker. Let's show our respect and appreciation for health workers and care workers by protecting each other and vaccinating all health workers everywhere now. Remember, ending this pandemic is one of humanity's great races. And whether we like it or not, we will win or lose this race together. I thank you.
Okay, so that was Dr. Tedros' opening statement for a media release on January 8th, asking for governments to step up and for manufacturers to step up in using COVAX to help distribute the vaccine around the world so that we all become safe from the pandemic. Okay, so let's move on to the federal response. As we said, the premiers are asking for more of the vaccine doses as soon as possible, and there are some statements that the federal government is making that they were promising a full country rollout by September, and of course this is January. So the federal government is already being urged by provinces and territories to actually step up the release of the vaccine. So let's listen to what is said by the federal government with the federal ministers, and of course Dr. Tam is going to make a statement in there also about how we do need to stick together. We do need to keep doing the same things: washing our hands, social distancing, wearing a mask while doing business in public, and not trying to avoid taking the proper precautions when being around other people that are not from our household.
Monsieur Duclos, on peut commencer?
Bonjour tout le monde, merci d'être à l'écoute. Je Je salue mes collègues qui vont bientôt vouloir présenter certaines informations suite au point de presse du premier ministre Trudeau. Nous allons commencer par la ministre Annan, qui est la ministre de l'Approvisionnement et des Services publics du gouvernement canadien. Nous entendrons aussi la docteure Teresa Tam, qui est la ministre en chef de l'Agence de la santé publique du gouvernement canadien, ainsi que le docteur New, qui est l'administrateur en chef adjoint de la santé publique au Canada. Nous entendrons aussi le major général Fortin, qui est responsable du déploiement au sein du Centre national des opérations, ainsi que la docteure Sharma, qui est conseillère médicale en chef de Santé Canada. Avant de passer la parole à ma collègue ministre Annan, j'aimerais tout d'abord rappeler certains des points importants que le premier ministre Trudeau a partagés il y a quelques instants. Tout d'abord, un message d'empathie et de sympathie à l'endroit de nos voisins et de nos alliés américains qui vivent des moments difficiles pour leurs institutions démocratiques. Aussi un message de sympathie à l'endroit des familles et des proches des victimes du vol 752 qui a été abattu il y a 1 an en Iran. Donc des moments sombres que vivent beaucoup de gens à la fois ici au Canada et aux États-Unis. Ceci étant dit, nous avons aussi entendu de la part du premier ministre Trudeau un message solide d'entraide et de collaboration au sein de notre fédération canadienne. And for this reason, I would like now to turn to Minister Annan, who will provide us remarks on the vaccine delivery and administration within Canada.
Merci beaucoup, Jean-Yves, et bonjour. Avant de commencer, je voudrais remercier tous les gens. Je m'excuse. Je voudrais remercier tous les gens sur la première ligne pour leur travail important. I want to thank sincerely the health professionals across the country for their work as they continue to protect Canadians on the front lines. 2020 was extremely hard on so many fronts. And while we begin 2021 in the midst of a very serious situation, one that requires more and sacrifice than ever before, we have real reason for hope. Aujourd'hui, je voudrais prendre quelques instants pour parler. Today, we would like to take a few moments to update Canadians with regards to vaccines. I want to start by saying, while Canada has secured one of the most diverse and robust vaccine portfolios, we are now focused on getting doses into Canada at the earliest possible moment. That is precisely what we did last month when we secured early delivery of the Moderna and Pfizer-BioNTech vaccines, just as they were being authorized by Health Canada. Vaccine doses are now arriving at a steady pace, and we are on track to receive a total of over 1 million doses by the end of this month. I know many of us would like to see that rhythm increase. The rate of vaccine deliveries is increasing and will continue. We are on track to receive 6 million doses by the end of March, 1.3 million doses of those by the end of January, 1.9 million doses by the end of February. These deliveries are being made on a schedule shared publicly and with the provinces. And Major General Secretary will expand on delivery numbers in a moment. PHAC is pushing the deliveries, sharing those schedules with the provinces and territories. I want to assure Canadians that I, along with my colleagues at PSPC, are working nonstop to accelerate vaccine delivery schedule. Due to the earlier start of the deliveries in December, we are well on track to receive enough vaccines for everyone by the end of September. And let's remember, we are now at the beginning of January. I believe it is also important to remember that all of us at every level of government, in opposition, in media, and across the country, want the same thing: an end to the pandemic and a return to our normal lives. We are pushing the exact same direction, and we must continue to collaborate. Together, we will get through this. Thank you.
Thank you, Minister Anand. Dr. Tam, please.
And good afternoon. Bonjour à toutes et tous. There have been over 635,000 cases of COVID-19 in Canada, including 16,579 deaths and over 80,250 active cases across the country. Nationally, the average case count is at 7,672 new cases being reported daily over the past week, and the number of people experiencing severe illness continues to increase. There are an average of 4,336 individuals with COVID-19 being treated in Canadian hospitals, and over 800 of whom are in critical care. And 136 deaths are being reported each day. Canada continues to monitor for virus variants that may be associated with an increased risk of spread. To date, there have been 14 cases of a variant virus first reported in the UK, United Kingdom. As the rollout of COVID-19 vaccines proceeds across Canada, including during this initial phase to protect those at highest risk of severe outcomes or exposure, keeping Canadians up to date with timely, factual information is a top priority. The Public Health Agency of Canada is working closely with provinces and territories, Health Canada regulators, and other federal jurisdictions to collect information on COVID-19 vaccine safety. Starting today, the information will be posted on canada.ca and updated weekly on Friday afternoons. The weekly COVID-19 vaccine safety report will include information on adverse events following immunization, which involve any health problem that happens following immunization, but is not necessarily caused by the vaccine. Adverse events can range from common mild events such as soreness at the site of injection or a slight fever to more rare serious events such as a severe allergic reaction. Canada has a robust vaccine safety monitoring system in place, and all serious events will be investigated. As of January 1, there have been over 1,015,000 doses of COVID-19 vaccines administered across Canada, with 9 adverse events reported. There have been no unexpected vaccine safety issues identified to date. As with any new undertaking, we all have questions. These weekly reports on COVID-19 vaccine safety aim to provide Canadians with regular access to credible information that will assist them in making informed and confident decisions on vaccination for themselves and their families. As always, I call on healthcare providers to listen to Canadians' questions and concerns and to encourage ongoing dialogue to further support vaccine confidence. The progress we have made across Canada and around the world on vaccines is inspirational, but everything we've achieved is the result of consistent, persistent, and collective efforts. We've worked hard and we've kept up the pace. Though I know we are all eagerly awaiting more hopeful days ahead, we've still got a ways to go. We all need to maintain core public health practices, hand washing, masking, and spacing away any and all opportunities for COVID-19 to spread. And we wait for our place in the vaccine. As we wait for our place in the vaccine queue, Let's continue to support those who need to be protected most urgently and do our part to help all those working to make vaccines available for all Canadians in the months ahead. Thank you.
Okay, let's move on to British Columbia, where we had some statements made about the reporting and updates and upgrades done to dashboards and automation of reporting to people living in British Columbia. Dr. Bonnie Henry has come on fire a couple times about how data is reported to the public and to the media, and there's been some measures taken to clear up this and help speed up the process of getting accurate information to people. Along with the rising cases in British Columbia at a nearly alarming rate. And let's listen to what Dr. Bonnie Henry and Adrian Dix have to say about what is actually going on.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Thursday, January the 7th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. There will be a written briefing tomorrow at approximately 3 o'clock, providing information about case counts and other relevant information about COVID-19 in British Columbia. And with that, and then on Monday we'll be back here in the press theater to provide a briefing on COVID-19 on that day. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. Today we are reporting 761 new cases of COVID-19 diagnosed in British Columbia, bringing our total number of people with COVID-19 to 56,015. Of the new cases, 94 people are in the Vancouver Coastal Health Region, 484 people reside in the Fraser Health Region, 23 people are on the Vancouver Island Health Region, 96 people in Interior Health, and 64 people in the Northern Health Region. We now have 6,349 active cases in all areas of British Columbia. 372 people are in hospital, 74 of whom are in critical care or ICU. In addition, there are 8,849 people, plus some additional from Northern Health who are under public health monitoring. And 47,374 people are now considered recovered. Sadly, we've had an additional 8 new deaths from COVID-19 in the past 24 hours. All of them are seniors and elders from long-term care in Fraser Health, in Vancouver Coastal, and in Interior Health. That brings the total number of people in British Columbia who've died from COVID-19 to 970. And our condolences go out to the families of these 8 people and all of our people who have died from COVID-19. We know that their families, their care providers, and their communities mourn the loss of their loved ones, and we feel your loss as well. We have one new healthcare outbreak at the Saselwatul Lalem long-term care home on the Island Health area, giving us 51 active outbreaks in long-term care and assisted living and 10 in acute care. That involves 2,333 people, 1,501 residents, and 752 staff with active cases right now. Since the start of our immunization program, we've now, as of yesterday, have provided vaccine to 41,064 people in every health region across British Columbia. As we know, the burden of COVID-19 has been particularly heavy excuse me, on our seniors and elders. and those who care for them. And that is where our focus has been and will continue to be for the next week or two here in British Columbia as we use the vaccine that we receive. And we're going to continue to focus, as we say, to try and protect those who are most at risk in these first few weeks with the limited supply that we have. And we will be expanding that, as we talked about on Monday, as supply becomes available, to ensure that we can protect as many people as possible, as quickly as possible. I also wanted to give an update on the UK variant that we reported on our first detection of somebody who had traveled from the UK into British Columbia with that variant. That person has remained in isolation. However, we have now 2 additional cases, both household contacts of the first case. There are no other contacts, and we do not believe that anybody else is at risk of this variant. And I will also say that we have been continuing to do surveillance and testing of isolates from people who have traveled, and also a selection of people from around the province on an ongoing basis. So we have not yet found any other cases in BC with this variant, although we continue to monitor and to test. So today, there was a couple of things that happened. There will be, from the first time we've had COVID-19 cases almost a year ago in our province, we've tried our best to share the latest information about the pandemic. We know it's important. It allows all of us to understand how we are progressing, how the pandemic is affecting us, and the trends we are developing, so we can make our own informed choices about our personal actions and the actions that we are doing collectively. Over the past few weeks, we have been trying to automate at least some areas of the collection and reporting of our daily case numbers. As a result, there will be some changes to how the data will be reported going forward, to streamline one aspect of what is a challenging, complex, and labor-intensive process. And you will recall in early December and in November we've had some challenges with new information systems being come online, with some applications and challenges in reconciling numbers from different health authorities. Our new system is going to be based on automatically reporting lab-confirmed cases from the previous day, plus reconciling with the health authority cases, particularly epidemiologically linked cases, to provide more timely reporting of data. So as you know, the BC CDC dashboard and data tables are our source of truth, and they are where all the corrected information will go, and they will now start being reporting by our lab result date. So this is a bit technical, but for those people who are following this closely, most of our EPI curve on the dashboard has been by what we call reported date. So that's the date that the health authority receives that report and starts the investigation on that individual case. They then pass that information back to the BC CDC to provide the provincial level update and consolidation of numbers. So we're now doing it, we're taking away one piece of that and having the lab report both to the health authority and to BC CDC directly, so that we can have a more timely reporting of the lab cases. There will be an adjustment in tables to reflect the fact that the lab results may be slightly it may come on a different day than what the reported result is. Usually it's within a day or two. So there'll be slight changes, and we're gone back and moved all of the cases from January of 2020 up until today onto this new lab reported date. So for those who have been looking at the EPI curves and our 7-day rolling average on an ongoing basis, it will look slightly different, where some of the numbers moving backwards or forwards by a day or two. There also is a slight increase that we've seen in case counts today, and for a few days as the new system kicks in and the previous lag that we used to have from positive result to reported case is eliminated. So as we know, every day the numbers are from a time, a cutoff. They're a snapshot in time, and they get updated and verified and corrected as more information comes in. And as so, there will continue to be fluctuations in our numbers as cases are verified. So, for example, if a case is reported in Interior Health today, and then we find out it actually is a person who comes from another province, that case would be removed. That's why it is important for us to also pay attention to our trends over time, the 7-day rolling average being the one that we watch very carefully. And the daily case count, as I said, is just a snapshot, but that rolling average helps us understand our trends as we're moving along. Importantly, what remains the same is every case is still counted, and every person who is positive is still notified as soon as possible, and contact tracing and follow-up, and particularly to identify new clusters and outbreaks, continues as usual. In addition to the daily reporting, we will be continuing with a number of weekly reports and adding 2 new reports. So, as you know, we provide our PPE report, the surgical renewal, and the healthcare hiring report. Our weekly surveillance report from BC CDC comes out on Wednesdays, and that has the details around ages and some of the epidemiologic information broken down by health authority, the granular information by local health area, etc. And also, we'll be adding weekly vaccine updates by health authority and a summary of long-term care outbreaks, which came out today. Are you going to talk to that? Yeah, okay. I think I know people are wondering what is going to happen, and like every part of Canada and countries around the world, the risk of spread of COVID-19 remains very high right now. And we are seeing new cases and clusters and outbreaks emerging around British Columbia, around Canada, and around the world. Here in BC, we continue to monitor our pandemic, and we will continue to do all we can to protect our province, as we always have been. In the last days, we have seen a slight increase in our cases, and our curve is trending upward. Now is our time to stay the course. We know what we need to do to bend that curve back down. We have been successful in doing that prior to this winter break, and we need to do that again. As a result, our current provincial health officer orders on all gatherings and events have been extended through to February 5th, 2021 at midnight. This means that the same requirements that we have had, including restrictions on social gatherings in people's homes, on all events and public venues and private venues, and the restrictions on sports activities, continue to apply. We are closely monitoring our progress, and if further action is required, we will take that. If we see positive trends in our cases and our hospitalizations, and we see a lessening of our impacts, we will monitor that as well. Right now, we need to hold the line. Our public health orders for the next 2 incubation periods are important to ensure we are doing all we can to keep everyone in our province as safe as possible, especially now that we have vaccine. We are in this period of greatest risk and greatest potential benefit, and we need to have the room to provide vaccine. These orders enable our healthcare system, our schools, our essential workplaces to continue to stay open. This is important for all of us, for our mental, physical, and emotional health. We know that transmission is less likely to occur in these controlled environments that have the many layers of protection in place. It's what we do outside of these environments, outside of our home and in our homes and workplaces, that is a concern. We know the vast majority of people in British Columbia are doing the right thing, and we saw that with many people who put aside their celebrations and travel over the holiday season. However, the number of new cases we are seeing in every health authority shows us that some people made the decision to make an exception for themselves. It may seem inconsequential. It may not have been done with the understanding of the impact it could have. But if 10,000 people, a few people in every town, every village or city in our province, makes these small concessions for themselves, that increases all of our risk exponentially. That's why, no matter how tired we are, we must stop and rethink and redouble our efforts now. This virus doesn't know that we haven't seen our friends in months. It doesn't know that it's our grandmother's birthday. It doesn't know when we let our guard down, it's transmitted. And it's not intent. And this is what we are seeing now. Things like gathering for lunch at work with people you work with, small parties with friends who've just returned from Europe. The virus reminds us how interconnected we are, and we have seen this over the past year. This is a global pandemic. A variant that arises in the UK affects us. Surges in Quebec, in Ontario, in our neighbors, in Washington State and Alberta affect us. But our pandemic is unique, and we know what we need to do in BC. This is our riskiest time right now. We cannot let our guard down, as vaccine is just beginning. This is our winter, but we know that spring will come. Right now, I want everybody to reach out virtually to support each other. We need to protect our seniors and elders even as we're moving along with our immunization program. But it's a time for each of us to commit to our own individual heroism, young and old. And I know we can do this. We can do this because it makes a difference for our family, for our community, and for our province. And we do this here in BC with compassion. We go outside, we walk together, we support each other, we go for a distance walk with our neighbor or our friends. It's compassion and understanding that we need now to get us through these dark days. We can all look forward to that end that is in sight, and it is in sight. But we must act now to get there sooner and to protect those we care about and to protect those we don't know. Without a doubt, there are brighter days ahead, where thousands more will be immunized for COVID-19, the weather will be warmer, and the spread of the virus will be slowed. But now we need to work together, knowing that what we do will make a difference for all of us tomorrow. The actions you take today make a difference. And I want everybody to take those actions that we need to do to support each other. We need to go out, do something kind for somebody. Make an effort to support those people in your community who are suffering. We know this time of year is challenging. We know that people need support. And we know that it's going to be a while until we can get back to the types of activities that we really want to do. We need to continue to be kind to each other. We need to have that compassion, to recognize we don't know everybody's story, and to stay calm. And that's what will keep us safe through this winter.
Okay, so we heard from Dr. Bonnie Henry where cases are going up, and they have actually put back in place restriction measures until February 7th, which means that we cannot have social interaction in each other's homes, and along with the other measures that limit services in restaurants, and that we should still continue to remember, again, to wash our hands, wear a mask while in indoor public places, and make sure that we stay ventilated and social distance. So, as reported a couple days ago about there was a riot in Washington, D.C., and that riot was incited by Donald Trump, who is the outgoing president of the United States, as they wait for President-elect Joe Biden to take office. And the Capitol was attacked. There was, at least as far as we know, one death involved. There's still many arrests to be made. And along with this, articles of impeachment have been filed against Donald Trump, and they're also looking to invoke civil suits against Donald Trump because of the actions that he has taken while leaving office to try to stop or block Joe Biden's victory in the election that recently happened in November in the United States. And there are still a number of things that are happening down there involving the transition between Donald Trump to Joe Biden. So we wish everybody in the United States a lot of luck with the transition, and we can also congratulate Joe Biden for sticking this out and being the type of strong leader that the United States may actually need. So with that, thank you for listening, everybody, and you've been listening to Policy and Rights here on Depictions Media Radio, and I am Michael. Please do tune in next time for more continued updates.
Close the vacuum. Close the vacuum. Close the vacuum. Close the vacuum.